So let's start with a scary one, being the chest. So God or our creator, or whatever you believe in, made it really interesting that we literally have this cage, our rib cage, our sternum, surrounding the maybe most vital structures in our body, which is our heart and our lungs. So I always find this very interesting. So most penetrating chest wounds can be dealt with just a chest tube, okay? A lot of times we don't actually have to open the chest, be it a thoracotomy or a median sternotomy, to fix things because it's so well protected. So that might be a little contrary to what a lot of different maybe TV shows or movies kind of exhibit, but that's the truth. Now, the abdomen isn't as well protected. So we have our small bowel, our large intestine, and other vital organs such as the liver, the solid organs like the liver, spleen, pancreas in the back here. So all these things we can take care of for the most part. But there is one area that we refer to as the surgical sole, which is right here in the middle of the abdomen, in the back of the abdomen, in the retroperitoneum, where the head of the pancreas sits, which has the duodenum which comes around it. This is a really, really critical area that if there's a penetrating injury there, gets you into big, big trouble. Now, the neck is also a dangerous area for penetrating injuries. We consider it a true penetrating injury once it violates the platysma, and then we always want to get a CT angio to evaluate the vasculature. Then typically we like to do a bronchoscopy to evaluate the trachea and the aero tract, if you will, the respiratory tract. And then we say the aerodigestive tract because then also the esophagus running back here, we'd do an EGD. So those are the three things to check out the neck. The head also, again, super protected, right? So it does pose a challenge, but a high-speed projectile can obviously, like a gunshot wound, cause a penetrating injury to the skull and cause a devastating traumatic brain injury. And then extremities, we're always concerned about hard vascular signs, so damaging to the arteries. And at that point, we would try to temporize something with maybe a shunt to jump around the injury or repair the injury primarily, or get our vascular surgery colleagues involved. So those are different areas of the body, but again, going back to the beginning with the chest, it is really incredible that we were engineered with this literal, almost bulletproof vest that